Mrs. Stocks. How are you doing today?
I'm doing good.
Good. How's your pain today?
It's good.
Okay, and how's your baby?
She's happy.
Yeah? How was your night?
She didn't sleep much.
Didn't sleep much. So, you didn't sleep much either, huh?
No.
No. Can I ask you, do you have a spouse at home?
Yes.
Okay. And do you have any other family that will be supporting you while you heal?
My mother.
Your mother will be? Okay, good, good. Would you like them there while we go over any postpartum discharge instructions?
No, we'll be okay.
Is this your first child?
No.
No. Okay, so you kind of know, how the postpartum stage will go. Okay, well, I do have to go over a few things with you just so that you're aware of everything before we can discharge you, okay?
Okay.
Okay, so you did have a vaginal birth, and I see that it's not your first vaginal birth. So I know you're aware, but I do want to let you know the things to look out for in case there could be like a hemorrhage or any infection. So you need to look out for heavy bleeding or discharge. If you have like dime-sized clots in your pad, that's okay. But if you're seeing like a fist-sized clot and you can't get the bleeding to stop, you need to call your provider immediately to let them know. If you're seeing a change in the amount or the odor or the color, please let us know. That should lighten over time. So you need to change your pads often. If you're saturating them within an hour, you're going to need to call the doctor. When you use the bathroom, make sure you use your peri bottle and kind of squeeze some water onto your vagina just to make sure that the area is clean. Do you have a peri bottle at home? Do you need us to get you one?
I'm okay.
Okay. How are you feeling where you gave birth? Are you having a lot of pain?
Just sore, just really sore.
Okay, so for that you can use ice packs. We can get you some Dermoplast spray to spray on the area, or you can use Tux pads. Some women even will like freeze. They'll put water on a pad at home and freeze it and then put it in their underwear. Just, make sure that the pain isn't getting out of control. And if you're having any drainage, you need to let us know, okay? Because that could indicate an infection.
Okay.
So, let's see. Once your discharge has kind of ended, within 6 to 10 weeks, your period will come back. And that's if you discontinue breastfeeding. If you continue breastfeeding, your period should come back within 3 months. And during that time, before your period comes back, I do want you to know that just because your period has not come back does not mean that you cannot get pregnant. Okay? So we want to make sure that you are either using a backup form of protection or you're getting on birth control. If you do get on birth control, you need to get on one that is safe for breastfeeding moms, and that is either going to be the mini pill, which is a progesterone-only birth control, or you can do the Depo-Provera shots. If you do choose to use the mini pill, you have got to make sure that you take it at the same time every day. Otherwise, you will need to use a backup method of birth control because you can't get pregnant again.
Okay.
And when you realize that you have missed that pill, you need to go ahead and take it immediately. So the thing about that is we don't want you to get on birth control until your breast milk has come in fully, because sometimes the hormones can mess with the breast milk production. Do you know if there is a specific type of birth control you want to be on? Would you prefer an oral method, or are you wanting to go the shot route, or are you done having kids and you want to discuss other options with your provider?
When do I have to decide? Do I have to decide before I leave? Before I get
No. Just something to be thinking about. Maybe you can speak to your husband about it.
Okay.
Okay, so have we decided we are going to breastfeed?
Yes.
Yes. Okay. Have you done this before, or is this your first time?
Yeah, I'm familiar.
You're familiar? Okay. I can see you have your boppy here, so it looks like you're good with position for the baby. There's different positions like cradle or the football hold or side lying. How has breastfeeding been going so far?
She's taking it pretty well.
Are your nipples sore?
Yeah.
A little bit sore, okay. So when your nipples are sore or cracked, you can use some lanolin on them, and that will help with the soreness. And you can also sometimes just squirt a little bit of breast milk on them and kind of let it air dry. And I can also let you see a lactation consultant while you're here. And she can see if there's any like problems with tongue ties or if she's having trouble latching. Would you like to see a lactation consultant?
Yeah, that'd be great.
Okay, I can get that set up for you. So a couple things I do want to let you know. If you're having problems with like swelling or engorgement in your breast, I would encourage you to use ice packs. And you can also get in the shower and let the hot water roll over your breast, and it will help kind of with your letdown so that you're not so full and engorged. It's very important that you wash your hands every time that you feed the baby beforehand, because you are touching your breast while you're getting the baby to the breast, and we don't want any germs going into the baby's mouth.
Makes sense.
Yeah. Make sure that you are staying hydrated, because you need a lot of fluids in order to make breast milk for the baby.
I always have my Stanley cup.
Well, that's good. That's good. We used to have those, the big bottles, or not the big bottles, but the big cups that we'd give our patients. But, who needs those now with Stanley, right?
That's right.
Of course, those cups cost you several $1,000s versus a couple hundred for a Stanley. So with breastfeeding, we want to make sure a baby's eating every 2 to 3 hours until she's back up to her birth weight. At that point, once she comes back up to her birth weight, she can start feeding on demand. And I'm sure you know how this goes since it's not your first baby, but she's probably been wanting to eat a lot so far anyway, huh?
Yeah, it's pretty much been nonstop.
Nonstop, yeah. You must be cluster feeding right now, which is good because that helps to get your breast milk supply.
Let down.
Yeah, well, not let down. It helps to get your production going. Because sometimes that can take a few days to go in. So baby's doing her job to make sure that you're making milk. So she should be eating 8 to 12 times in a 24-hour period. Let's see. I do want you to be checking to see if you have any redness or swelling in your breast or any streaking. If you're having a fever or flu-like symptoms, that could mean that you're having mastitis, and could be from like a clogged duct in your breast, and we can get you on an antibiotic to get rid of that. As far as medications go, are there any medications that you were taking that you will need to continue after your pregnancy?
No.
No. Okay. So if you do get prescribed a medication, you do need to make sure that that is safe for breastfeeding. And just continue with what your doctor has prescribed postpartum. And then when you go for your 6-week checkup, you can discuss birth control methods with him. I do want to say the narcotics that you were prescribed, you need to be sure that you are not driving while taking any narcotics, and not caring for the baby by yourself while taking narcotics, because you could fall asleep and the baby could be hurt or suffocated if she's in your arms. Okay, the next thing we're going to go over is, let's see. So activity. I know you like to work out, but I do need to tell you that you need to take it slow going back into the level that you were at before pregnancy. You cannot hop right back in and go back to that lifting heavy weights, okay? I know. So you need to start with like walking a little bit. Start by, limiting your amount of time going up and down stairs, because you did have a vaginal birth. And so that's going to be hard for you to do, just walking upstairs. So limit your trips up the stairs. I need you to just do a little bit of light exercise. And as your body allows, you can become a little bit more strenuous with your exercise, okay? And do not do anything crazy until you are released from your doctor and they say it's okay. All right?
There's all those gains.
Yes, I know. Your driving should be limited for a week or two. So just make sure you have somebody that can drive you to appointments until you're released from the doctor. There's no law that says you really can't drive, but we would prefer that it be up to 6 weeks, just because, you could still have a hemorrhage. Your body is healing inside. You have a huge wound inside, and we just want to make sure that you are feeling okay before you get back out on the road driving a piece of heavy machinery.
Makes sense.
Yep. Okay. So we did go over signs of mastitis, but I want to go over some other signs of infection that you could see because, again, like I said, you have a very large wound inside of you, and there's a multitude of things that could occur that we want to look out for. So we want to look out for chills, fever, changes in your vaginal discharge. If it was lightening up and then it's coming back and the color has changed from lighter to dark, if it's smelling different, if you have a larger amount, if you're having any pain, burning with urination, or if you're seeing that your calves are getting like red or they're hurting, let us know. You could have a blood clot in your legs, you could have a urinary tract infection, you could have an infection inside of your uterus that we want to watch out for. We also want to look out for headaches or blurry vision that could indicate that you are having high blood pressure. So make sure you report any of those symptoms if you have them, okay? Okay. The next thing that we want to discuss is postpartum depression or postpartum baby blues. So it's very common for women to feel moody, and a lot of times like women will cry a lot for up to like 10 days postpartum. This is totally normal. Tons of women get it. It has to do with the surge of hormones in your body. If it does not go away within the first 10 days after birth, you might want to let your provider know. This could be developing into postpartum depression. This is also something that you're going to want your spouse and your family to kind of be on the lookout for, because sometimes you won't even notice that it's happening, but those around you may see a change in you, and it might save your life if somebody reports that to your provider. So some things that they can look out for would be persistent sadness, anxiety, irritability, changes in your sleep patterns. Of course, you're going to have changes because of the baby, but if you're wanting to sleep all day or you can't sleep at night, that would be something that would be a change. Feelings of wanting to harm yourself or others or your child. Those could be signs of postpartum depression, and you'll need to call your doctor immediately. He can get you on a medication to help, and you can also have therapy that will help. This can occur anytime throughout the first 12 months postpartum, and it likely will not go away without intervention. So you need to be sure that you're talking to somebody about that. Okay, so you have a checkup scheduled in 6 weeks on March 25th. That's a Monday. It's important to make this appointment, okay? Because that's when your doctor's going to clear you, and he'll set you up with birth control. He'll talk about, he'll check to see if you're healed. He may release you to do strenuous activity like working out. So definitely keep that appointment. Okay, so we're going to talk about the baby now. Did you have a name for the baby yet?
Ellie.
Ellie, okay. Baby girl Ellie. Okay, well, before we start talking about Ellie, I do want you to know that we stress, because it's flu season, if you have visitors, they need to make sure that they're feeling well, they've not been sick, they need to wash their hands before holding her. And we do encourage that all visitors do get the DTaP vaccine, just a booster, because it does have the pertussis in it, which is the whooping cough vaccine, and that's not something that we want our babies to get. So just having a booster will prevent baby from getting that. So baby, when you get home, you need to make an appointment for the baby with her pediatrician for her first checkup. And it should be within 2 to 3 days of her being discharged from the hospital. Okay. So, baby, has she been peeing and pooping a lot?
She's had bowel movement, and she's had several wet diapers.
Okay, good. That's what we want to hear. So she should be voiding, which is peeing, about 6 to 8 times per day, and having 3 to 4 stools per day. Okay. And I know that you were given a log to chart, how many pees and poos she has and how often you're breastfeeding. You want to keep up with that, because that will be something that you can provide to your pediatrician, and they'll make sure that she's on the right track to eating good and peeing good and pooping good. Okay, her stools, she is breastfeeding exclusively, right? Okay, so they should be like a mustardy color, and they'll look seedy. Like it will look like there's seeds inside. You're a breastfeeding mom, you know this. So as long as she's doing that, she should be good. All right. Her umbilical cord, how's it looking?
It looks good.
Yeah? Okay, good. All right, so that should dry off and fall, or dry up and fall off within 10 to 14 days. And you know that we'll remove the clamp before you leave the hospital, and that her little stump, you cannot get that wet. So no baths where she's submerged in the water until that stump falls off. Until then, you can kind of like blot around the area if you have to with just a little bit of water, but make sure it fully dries because we don't want that site to become infected. And signs of infection will be redness, swelling, or drainage from the site. Also, when you're changing her diaper, make sure that you're folding down the top of the diaper, or they even have those diapers that have like the little curve so that it's not hitting her umbilical cord, okay? All right, so with the bath, after the cord falls off, she can be fully submerged. But until then, you're gonna want to give her sponge baths. So you want to make sure the water is at about 100 degrees, and you can check that with either a thermometer, or you can like stick your elbow in the water and just make sure it's not too hot for your elbow, okay? Let's see. You want to keep the room that she's in warm while you're bathing her, and you'll want to keep her fully wrapped up in towels while you're bathing her. You're only going to unwrap one part of her at a time to wash it. So you'll have her wrapped up in your arm, and you'll take one arm out, you'll wash it, and then you'll immediately dry it and then wrap her back up, take out another part of her body like the other arm, and so on. It's important to keep her warm because it's harder for babies to keep their temperature up. Okay, so you will start at the head and work your way to the dirtiest part of her body. So we'll start at the face, and for the face we only use water, and so you'll start at her eyes using a wet washcloth, and you'll wipe from the inner canthus, which is like the inside of the eye, out when you're wiping her eyes, and then you use a different part of the towel every time you wash a different area. Then you'll do like her arms and her neck and her core, and then the last part you'll do will be her bottom and her genitals, because those are obviously her dirtiest parts. Let's see, she may have cradle cap, and in that case you may want to use a certain type of shampoo on her head to try to get some of that, excess stuff off of her head. There's also even some little brushes you can use to kind of like scratch it off of her head some, but it will come out eventually. You also want to use baby lotion to keep her nice and moisturized so that her skin doesn't crack or get too dry. Okay, so we know sometimes babies can get fussy and scream and cry, and sometimes it can be overwhelming, but I do have to tell you, if you become frustrated, please make sure that you put the baby down in a safe place and walk away. Never shake the baby, because that can result in shaken baby syndrome, and that is a brain injury that can result in permanent brain damage or even death. Another important topic that we have to discuss is SIDS, sudden infant death syndrome. We don't know exactly what causes this, but we do know that the chances of SIDS are reduced if baby is sleeping in a safe environment. So that would be a crib that does not have any toys, no pillows, no blankets. It has tight-fitting sheets, no bumper pads. It's important that baby sleeps near mom and dad, but not in bed with mom and dad, because there are studies that show that babies are more likely to pass away if they are in bed with mom and dad, because they could suffocate.
We have a co-sleeper, so we're
Okay, perfect. That's great. Okay, so baby will sleep 16 to 19 hours per day as a newborn, and then she'll gradually be awake more and more as time goes on. So we talked a little about her keeping her temperature up when we were talking about bathing, but so babies have a hard time regulating their temperature. It's called thermoregulation. Excuse me. So they could get chilled or get too hot, and this can become stressful for them, and they will start breathing too high. They'll lose their oxygen, and that can become very detrimental to them. So her temperature should range anywhere between 97.7 and 98.6 degrees Fahrenheit. If her temp is below 97.7, then that would be considered hypothermic. To avoid that, you want to keep her warm by swaddling her just like you have her now, and wearing a hat, which I see she has, that will keep her from losing some of her warmth. You also want to keep her away from any vents or air conditioning unit or fan, and keep the temperature in the house set between 72 and 78 degrees. And like I said, while we were talking about bathing, dry her immediately. Don't let her keep water on her skin, because that could cause evaporation, which will cause her to lose some of her temperature. And the best way to maintain her temp is through skin to skin. Do you and your husband ever do that with her?
Mm-hmm.
Okay, yeah, that's one of the best things you can do for baby. It helps with bonding, it helps with her thermoregulation, and it even helps with her vitals, like her breathing, her heart rate, and everything. They're more under control when you're doing skin to skin with her. So I would encourage that. So to check her temperature, the best way will be through a rectal temperature or a rectal thermometer. That will give you the most accurate temperature reading. And then another way you can do it is axillary, which is under her arm. I would not do in her mouth, because it just doesn't work for babies. So you may see over the next few days her skin may become a little bit yellow, and that would be from jaundice. Are you familiar with that?
Mm-hmm.
Okay, so that will be her bilirubin levels will kind of peak between days 3 and 7, and then you'll see it taper off. So she might look a little yellowy, orangey. Best thing you can do is continue to feed that baby, and it will push all that bilirubin out of her body. And you can also keep her like by a window, as long as there's not a draft. Like a sun, if the sun's coming in, that will be a great place for her, because that helps with the bilirubin as well. Y'all have a car seat installed already?
We're all good.
Okay, all right, so you need to make sure that she's buckled in appropriately in the car seat, and it needs to be installed in the middle of the back seat. Her buckle should be at armpit level and snug, and you need to keep her rear facing until she's 2 years old. Never leave the baby unattended in the car seat. Because they don't really have head control, it can cause her to cut off her breathing, and she could suffocate. Okay, so for baby, she could also be at risk for infection. So you'll want to monitor her temperature, and anything greater than 100.4 or less than 97.9 needs to be reported. If she's not eating, if she's vomiting, if she's not urinating, if she has diarrhea, if she has labored breathing, like if her nose is flaring or she has retractions in her chest, let us know. If her skin has a blue tint to it, if you can't wake her up, if she will not stop crying no matter what, if she has any draining or bleeding at the umbilical cord site, or if there's any drainage coming out of her eyes, we need you to report that immediately. Okay, let's see. Have you ever used a bulb syringe?
Mm-hmm.
Okay, so she probably has one of those in her cot over here, the crib. So that is for suctioning out of her nose and her mouth. A lot of times babies will have some mucus or saliva that will make it difficult for them to breathe. So we keep that so that we can clear her airway. So what you need to do is you'll have to squeeze it and then put it in her mouth over to either one side or the other, not straight down the middle, because that could cause her to gag. And just kind of suction, slowly release the bulb to suck the saliva out of her mouth. And same thing for the nose, make sure you squeeze it before inserting into her nose. All right, and that should help with her secretions. Okay, so it's important that you have her attend her wellness checks. I know you're gonna set up an appointment for her when you get out of here. And the reason that we want you to have those wellness checks with her pediatrician is so that she can get her vaccinations on schedule, and also so that they can monitor her growth and development to make sure that she's growing at the appropriate rate for her age. All right, so then I'm just gonna go over a few safety tips, and we'll be good to go, okay? So the first one, never leave baby home alone or with small children or pets. Never leave baby unattended on a changing table, a bed, or a couch, because she could fall. Only place baby on her stomach if she's doing tummy time and she needs to be supervised. If she falls asleep, don't let her stay that way. You need to keep the baby away from small toys, coins, etc. Basically anything that can go through a paper towel roll, you don't want her to be around, because she could choke on it. And that goes for the cords on blinds as well. No. because they could get wrapped around her neck. So anything like a string will need to be moved out of her way because she could be strangulated. You need to place smoke detectors throughout your home, and do not smoke around baby. If you do smoke outside of the home, please make sure that you wash your hands because smoke and secondhand smoke can be very bad for the baby, okay?
Okay.
Do you have any questions?
No, you're very thorough.
Okay. All right. Well, thank you so much, and congratulations again.